India is facing a health crisis. More than 100 children have died due to an outbreak of encephalitis in the eastern state of Bihar. Encephalitis is an inflammation of the brain mostly caused by a virus. The poor are the worst affected, and the inadequately staffed and ill-equipped public health centers are struggling to cope. This raises a very urgent question. Can India afford healthcare for all? What's happening in the eastern state of Bihar? Why do we have so many deaths there? And why is it that private health sector is not able to cater to these?
Firstly, you have poor social conditions where there is a huge amount of malnutrition. In the state of Bihar, about 48% of the children under 5 are malnourished, stunted. And when they do fall ill, the health system is unable to provide care close to home. Why is it that these children have to be taken hundreds of miles away to a large city hospital when this firstly could have been prevented, and secondly, care could and should have been given at the sub-centers and the primary health centers, or at the maximum in serious cases in the district hospital?
Everything that people in rural India require is actually broken in terms of health systems. So we have, poor human resource deployment, physicians who are there predominantly in the cities and not moving out into the rural areas. And those who are there also are not accounted for.
These people who are in the eastern state of Bihar are actually the poorest of the poor, who can't really afford a private medical treatment and paying the price. Why should quality healthcare be only for the few?
DEVINA, this is what happens. Everyone, it's easy to go after the private sector and say that you guys are swanky, you guys fleece people, but really that's not reality. And when you need to put up these expensive facilities and you start paying for the best of doctors and staff, at that point it all adds up and it costs money. India spends $120 is the healthcare per capita spend. So in that 120, whereas in England, for instance, it's about 4,000 pounds. But just remember, it's $120 per cap, and we're all giving you the best of quality care within that.
I want to bring in, what are the solutions then? What are the solutions that we can look at? Because as Shobna mentioned, one of them is telemedicine. Now, do you see that working in India, where you have a doctor who is sitting in one part of the country and is connecting to patients in remote areas over cell phone or over mobile phones? Does that work?
Certainly, we do need technologies, of which information technology is one, and its various forms that one can use. But I think what we require far more is human technology. We require human resources who are trained, who are serving, who are accountable, and who also could use information technology. But that alone, or that cannot be the predominant, game, the changer.
Well, the other initiative,
but I would say
yes,
here,
go ahead.
In terms of what the country requires is universal health care, which includes healthcare coverage plus acting on the determinants of health.
Absolutely.
If you're talking about the context of these deaths that have happened here, and prevention, I mean,
absolutely, absolutely.
So they acting on determinants. If nutrition was worked upon, for example, we have known it for a few years that these deaths that have happened in Bihar have been happening every year. But we have chosen not to work on nutrition as a major determinant.
And that's the area that you actually actively work in, Dr. Reddy. And why is it that still the preventive health care is not the first step which is being taken by many states?
See, prevention acts at multiple levels. Firstly, you require policies which actually change the social conditions, whether it's nutrition, water, sanitation, or making unhealthy foods costly and healthy foods cheaper, or control of tobacco, all of that. But then you also require a lot of community empowerment through health literacy and enabling them to protect their own health. And of course, number of preventive services like immunization and so on and so forth. All of these have not been given adequate attention because we have neglected our health system, and therefore we are all the time doing the mopping exercise of treating very sick patients who come to the hospitals. So we need to actually invest more resources financial and human, in terms of prevention and
What
health
are the
promotion.
models that you would suggest?
Well,
International models that have worked for other countries, which can be adopted by India?
Well, in our own neighborhood, we see Sri Lanka has done it very well. Even Bangladesh and Nepal have started doing it quite well in terms of good primary health care, community empowerment, women's empowerment in particular. Thailand has an excellent system of primary care as well as universal health coverage, and even advanced care is provided with low degree of financial burden to the people.
So I'll give you an example actually of nutrition and what it changed. During Indira Gandhi's time, remember when there was a huge iodine deficiency, entire population, and they made it compulsory for salt.
This is late 70s, early 80s that we're talking about.
Yeah, late 70s. For India to have iodized salt became compulsory, and we just wiped that out. If you look at the milk revolution, and I think these are the changes that it's not just hospitals, but the entire private sector. So, fortify some of the biscuits for children. So it's not just hospitals, but hospitals can play a role in terms of bringing these kind of solutions.
With that, I have to wrap up. Thank you so much for being with us. Thank you for tuning in. Do tweet your comment with #WorkLifeIndia.